Hello everyone, this is NainaMD, Beverly Hills, Fusion of Science and Beauty. Welcome to my show. I have a guest who will be doing the show today. His name is Dr. Stephen Ross. He's a co-founder of Advanced Med Academy, and I'm just going to let him take the show today. Here he is.
Well, thank you, Dr. Naina. So I'm the guest host today, I guess.
Yes, you are.
I'm the fill-in. Well, thank you very much for being here and allowing me to do this. As the president and co-founder of Advanced Med Academy, as you know, we've done a number of shows together and talked about the transition that's happening and the paradigm shift in integrative and functional medicine. And I think it's really important that we point out here that there is a paradigm shift right now happening in integrative and functional medicine. And as we know, integrative and functional medicine is really getting to the root cause of health challenges, but it's more than that. It's learning the science and the evidence-based medicine behind the integrative approach. In other words, looking at the whole body as opposed to silo medicine, which we're very used to, or acute medicine as we know today. Integrative and functional medicine is really dealing with the chronic health issues of today. Cardiovascular disease, diabetes, cancer, etc. And the reason that I wanted to bring you on to the show here today is you're one of our key faculty. And we're very, very happy and very proud to have you as one of our faculty members, actually one of our first faculty members. And you developed an outstanding program in hormone therapy. And the feedback we're getting is just off the chart about your program. We'll talk about that in a little bit here. And now you're working on developing a course on nutrigenomics, and we'll talk about that as well. But I'd like to start off by asking you what got you into this type of medicine, because as a traditionally trained medical doctor, you didn't even have the slightest bit of education in the area of anti-aging, regenerative medicine, and integrative or functional medicine. Those terms weren't even available back then.
Yes.
How did you get started? What was your interest? Where was your passion that got you to where you are today?
So my passion was actually starting in my 20s, and when I started to do a lot of research just on free radicals, I was interested in nutrigenomics. And I was always the person who was in with sort of to speak with all the biochemists, and there was only one conference at that time that was in nutrigenomics, and it was just very few people. The word was not really even utilized as readily. This was back in the 80s. And so I always wanted to know what the pharmacology of vitamin C is, what the pharmacology of vitamin E, of tocotrienols, and these are terms that nobody understood, that there's actually pharmacology.
So were you looking into this back in the days when you were in med school or after?
I was in college.
So your professors must have thought that you were a little nutty. Why you asking about
and
this stuff, right?
in fact, I clearly remember this, one of my professors kept my papers on free radicals, research on how free radicals and oxidative stress can sometimes is linked to aging. And I also remember I used to top organic chemistry, and I remember just organic chemistry trying to bring in and asking my chemistry professor, well, you know, what is the chemical interaction of nutrients? And he would think, what is this?
Why are you asking this?
Why are you asking
right?
this? Yeah.
So that must have been a challenge for your professors as well as for you, because there wasn't a lot of data back then.
There wasn't a lot of data, and there was also, subsequently when I went into medical school, I always still kept that interest, and I initially pursued a plastic surgery residency. My mentor was Dr. Krizik, and he brought me in to do research at the University of Chicago for studying how a hyperbaric chamber is going to help or benefit burn patients.
Right, and that's before it was really
utilized. This is before everyone was asking, my gosh,
what is... only for divers.
And everyone was wondering, what is Dr. Krizik doing, and what is happening at University of Chicago, you know, what is this happening?
So you turned the campus upside down.
We turned the campus upside down because we actually, a lot of the research was negative, because initially we faced two problems. Number one, we didn't even have back then amazing ways to measure free radicals.
Right.
We used the mass spectrometry, but it wasn't as finessed as it is today. Come on, I mean, now it's just a whole revolution. It's a revolution has been created in that respect. So even studying free radicals was very limited, and then we found that actually in burn patients it did cause actually more acute free radical regeneration.
Right.
So hyperbaric became better for diabetic and some other wounds, but not in an acute situation. So a lot of the data was negative, so the studies were not published. So it was sort of a very difficulties we faced during that time.
Unknown area of medicine.
So it was always unknown territory.
Right,
so I became very used to dealing with how do I handle a very conventional community,
Right.
and then how do I handle that? Always like having an idea that may not be so conventional.
Right. So you probably got a lot of pushback from your professors
got a lot
telling
of
you get
pushback.
back to your books,
There's a lot of
study your physiology, and don't ask so
and
many
there's
questions.
no studies or
Right.
a lot of
Right.
like where's the scientific data for this? Where's this?
Well, let's move ahead a number of years now. Where you are right now, you have a practice in Beverly Hills, and you really focus on anti-aging, all aspects of it. But your real passion is the aesthetics from the inside out, the nutrigenomics, the nutrition, and changing how the body functions physiologically with changes in lifestyle, with changes of eating habits, with nutrition and nutrigenomics. And you've made quite a successful practice of that. And one of the things that really got my attention was your ability to work with, in particularly women with hormonal issues. And the Women's Initiative back in 2002 was, came out and said, testosterone is bad for women, and bioidentical hormones wasn't even a part of that study. It was
the synthetic hormone replacement therapy. It was increasing the risk of heart disease, and or lots of things.
Right. So you've made an impact by the way that you evaluate the patients and the way that you treat them, and that's when we came to you from the academy asking you if you would write a program, write a course, which you did. And it's called Advances in Hormone Therapy. And it's getting rave reviews. And I've just got one testimonial here that I'd love to read to our viewers here. This comes from...
Good, you've not shared that with me.
This just came in.
Okay.
This is from a board-certified family nurse practitioner, Lizzie Johns, out of Rolette, Texas, and she said that we could go ahead and use this. So, I asked her a number of questions about your course, how she found you, and she was searching for you actually just through Google and found the course on the Academy. And she found the course very easy to follow. She found the learning platform very, very easy and user-friendly. And I asked her, I said, did you feel that Dr. Naina provided useful information? She said, absolutely. Dr. Naina's information was very helpful. I said, is it something easy that you can implement into practice? And that's really one of our key assets here in the Academy, is to not only teach the doctors the practical aspect and the science, but also walk them through case studies and then treatment protocols. So can you actually apply it immediately afterwards? And she said, yes, it's very easy to implement, and especially the bonus course materials. And you provided samples of intake forms and various other things that they can use to help evaluate their patients. She rated you all the way down as a 5 out of 5, which is the best of anything. The ability to explain the material, she says the content was very easy, very well explained, very informative, knowledgeable, and she discussed the pros and cons as well. And that's really important, because a lot of practitioners out there that are practicing hormone therapy, if they haven't studied what you're teaching, then, and we talked about this earlier, they're calling up the pharmacist and asking for their advice.
I was surprised when I started entering and learning about all of these. I had so many questions that weren't answered when I was learning this, and I was wondering why my mentors were not answering these questions. I'm going to go into just something very, very basic, and that is there are so many doctors who don't know what even different types of estrogen receptors are. And you are writing articles. Articles were being written, and so many things were being written, and we don't even talk about receptors when we're talking about hormones.
I think they're just looking at the basic labs, and they don't even know.
Looking at the basic labs. We weren't even questioning the validity. We weren't even questioning even how the lab tests were being done. What methodology of the labs that are using, what methodology they're using. So it's
and
you
just
go
get
into
so
that
detailed.
In your course, I go very detailed into that. I think that's very important.
Not only how to read a lab, what labs to use, what labs to request, how to interpret them.
And sometimes when the labs don't correlate with, and when to expect that the labs may not correlate to what you're seeing clinically, and what to do in a situation like that. Right.
And what I really like about your course, and this is where we're getting a lot of feedback, is the way that you prescribe. As opposed to just handing out a Trieste or Biest cream, you're providing I call it microdosing. So you're microdosing estrogen, estrone, estriol, progesterone, testosterone in individual tubes. And then you're teaching the doctors how to teach the patients to apply the small amount and then titrate over time. And I think most of what we're learning out there in hormone therapy is, oh, just give them a Biest, give them a Triest,
or they're using topical clicks, and because they don't want to really be honest with the dosing, or they'll just put them in all mixed together and things like that, and you never know what the effect of one is. And
and I think that's so important.
It can have very dramatic results. And first, what usually happens is the patients will, no matter what you give them, they'll feel better, but then they'll start getting unbalanced.
They'll drop.
And they'll drop out. And so the retention rate of people on a program is I think the key to success.
Absolutely.
And when I've been doing this for almost 20 years, I have, people, my staff will tell you, we have people that have been with me for so long, and we have people that have been with others, and then they come over and then they understand what I'm doing and they learn to get an appreciation. So it's not just something, I feel this is not just something that you can just say, oh, a little bit of this and a little bit of that. It's just not that way.
Well, and that's what's happening. And then the woman, for instance, will come back.
And you should never be calling your pharmacist. In my opinion, you shouldn't be calling your pharmacist.
Well, that's why we have this course, and that's why you're teaching it. So you can teach other doctors the right way to do it. But you're right. I mean, you give a patient too much progesterone, and they start having symptoms of, excess progesterone, or their estrogen dominance goes up, and these are symptoms that you talk about in your course, and how to evaluate those symptoms and then go back and correct that dosing, and that's really important.
And also it can have some very negative effects, and that's what people don't understand. That's where the safety becomes very, 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 very difficult to assess. The other thing I would like to mention is that so many people look to, I'm so very much some of the people who have been non-physicians and bringing the knowledge about bioidentical hormone replacement therapy by writing books. It's all about, it's all about being sexual, being sexy, being vivacious,
healthy
being
and vibrant,
energy and being vibrant. But I think one really needs to understand that the knowledge is there.
Well, and this is what we talk about.
This is not a magic. It's not something that's just magic, and everybody can just go. It's not like a bottle of Coke that you can just go and drink.
So it's personalized medicine. That's what we're getting at. But doing it right, do it safely, doing it effectively. And you're writing a book now on testosterone in women. We can't wait to see that as well.
Yes,
we hope to get that out into
It's been always a very controversial topic. It's been a very controversial topic.
Yeah.
Unfortunately, testosterone has been a controlled substance. I've always had a really hard time trying to figure out how testosterone, which is, and a lot of our even growth hormone, a lot of these hormones are becoming under guidelines of controlled substances. These are natural productions in our body, and they decline over time.
Absolutely.
And if we have bioidentical ways of making this, then pretty soon then there's so many plant-based hormones. And so what are we going to do? Outlaw plants? I mean, it's getting to a place where things are just not taken out of context, and then rash decisions are made based on that, and based on a small population of people who are using hormones not appropriately. And generally that's been regarded as the athletic, as the athletes, and the and some of the athletes are being, and maybe some of the, celebrities groups, entertainment industry. And I think that's a misnomer, because what those people are doing does not reflect what the 99% of the population is facing, and the dosing that they would be doing is just two different things. So it's been very, very much misconceptualized. It's been perceived incorrectly. The bioidentical hormone replacement therapy, and just hormone replacement therapy in general, has been, and the delivery systems so much of the studies have been done when it's taken orally. And as you know, when we take orals, it's very difficult.
Right.
So
So let's
I know
not
we're-
forget.
yeah.
Let's not forget about men in this equation also.
And men all the time,
They
I
need
treat,
it
yes,
as well.
absolutely.
You know, I just want to mention one last
I
thing
know we're
here.
running out of time, and yeah.
So I asked Lizzie one more question. I said, can you apply the information to your practice? She says, I already have started to use the knowledge in my practice by discussing with patients about hormone imbalance
That's
and
nice
doing
of you.
labs.
That's
And then
right.
finally I said, would you recommend it to others? She says, I've already recommended 2 other doctors. So I want to thank
Great,
you
that's
very
great.
much for being part of our faculty and very much for providing this information, this much needed information of how to properly and effectively and safely prescribe hormones. And I want to thank you for allowing me to interview you on the show.
Absolutely.
Thank you so much.
And your website is Dr.
AdvancedMedAcademy.com.
Perfect.
Thank you.
I hope education always leads to awareness.
Absolutely. Thank you.